Good evening, ladies and gentlemen, dear colleagues. Welcome to APSR webinar entitled Update on COVID-19 Situation in Asian Pacific region. This is series number 2. On the previous webinar, we learned attempts and approaches against COVID-19 from 5 countries, regions in Asian Pacific area. At this time, we'll share information from physicians on the front line in 6 countries and regions. In addition, at this time, we take more time for the Q&A corner, in which we should be able to get practical and useful information from the battlefield against COVID-19. The presenters in this webinar are as shown in the monitor, you can see. On the next presenter, Dr. Füsun Eyüboğlu from Turkey. Dr. Eyüboğlu, please start your presentation.
Okay, this is Füsun Eyüboğlu from Turkey Başkent University, and I'm a member of Turkish Thoracic Society. It's a pleasure to me to be here with APSR organization, and I would like to thank to the organizers for the invitation of me and Turkish Thoracic Society. I have nothing to declare and no disclosures about this talk. So as we had the first case on 11th of March, up to today we had 114 cases, new cases, and of these 1,621 of them were in ICU, and of these 845 patients were intubated. So of these total 114,000 patients, we had like 3,000 total deaths. And for now, the recovery of the patients is around 39,000. So as we had the disease later than the other countries, we had the chance to observe what's going on in other countries. And at the middle of January, Ministry of Health decided to establish a scientific board for COVID-19, and the Ministry of Health was the sole authority in the outbreak management. And we had time to observe and monitor the outbreak around the world. So it arrived 2.5 months later in our country, and we had time for preparedness of preparing a guideline for COVID-19, and we created algorithms for the healthcare workers, and we get prepared for producing our own PCR test in our central virology laboratory, and we got prepared our hospitals and the number of ICU beds. Also, we prepared enough personal protective equipment, and we get ready in terms of treatment, in terms of having the drugs who need it. And as we were watching the outbreak around the other countries, first we started to get action against limiting the mobility to other countries. And as we had the disease on 11th of March, then we started to get action against limiting mobility inside the country. So we first closed the schools and universities and restricted going out of the people over age 65 years old. And we implemented a curfew to the youngs under the age of 20. And we started to begin, by the beginning of April, do a curfew for the weekends. And this is our number of new patients, and this is our death rate. So this preparedness and this guidance has provided a standardized approach all over the country towards suspected and diagnosed COVID cases, and also diagnosis and treatment are free for all of our COVID cases. So let's start with the testing. As I said, we had a cumulative as like 1 million tests done so far, and the total testing, when we look to the OECD countries, and the other countries, tests amounts per 1,000 population is here, or mostly above 10, but we are in terms of testing 1,000 population, like our rate is 5.3. And first we trusted the PCR testing a lot. We thought that the susceptibility and sensitivity was high, but we got the results like the positive results was to 11 to 12%. And at this time, currently, I can say that we need to improve this testing. And the sensitivity and specificity was around 50 to 60%. So we had the feeling that we are missing some patients with COVID symptoms and positive CT findings. This graph shows the cumulative death numbers, which is around 3,000 now, versus ICU, and among them those intubated ones. So at the first 2 weeks, we started with standard regimens as recommended from our colleagues like China and other Asian countries. We started with hydroxychloroquine, azithromycin, and etc. But we saw that things are not going very well for all our patients. And but we realized that we had the favipiravir, and it was recommended to use only in patients in the ICU or the intubated ones. But we started to use this antiviral earlier, and we started to use it. We just give it every hospital at the beginning of April. And as you see, the number of ICU patients are getting increased, but I wouldn't say the same for the number of intubated among them. And we started to give favipiravir earlier, and it made, I would say, an important and significant difference in terms of patients intubating. When we look to the infection fatality rate versus current percent of all cases in the ICU and the intubated ones, you see our infection fatality rate is around 2.3 to 2.4, but the number of ICU patients and the number of intubated patients are getting decreased. And again, when we look to the doubling times and time-dependent doubling times of cumulative number of COVID-19 cases and deaths, we saw that the doubling time for new cases during March was 2 days, and the doubling time for deaths was 2 days. But in April, the doubling time for new cases was 6 days, and the deaths was the doubling time was 7 days. So this month we are getting better. The major reason is, as my colleague said, we started earlier the treatment of antiviral drugs. And again, we were just avoiding the high flow oxygen treatment at first, but then we started to move on and starting the treatment early in terms of high flow oxygen or non-invasive mechanical ventilation. And this slide shows the case fatality rate, which is decreasing, and versus the case recovery rate. And you see the scissors open between the CFR and the CRR. So we are getting there. We have recoveries, and the number of deaths are decreasing. So these slides were upon the data which our Ministry of Health has given, and but in the hospitals in many cities, my colleagues from Turkish Thoracic Society, while we were talking, we realized that there must be something missing in terms of the exact COVID patient, determining the exact COVID patients. Because we are still using the criteria for diagnosis of COVID-19, the PCR positivity. And we all noticed that cases with COVID symptoms and CT findings, but negative PCR get diagnoses other than COVID. So, when we looked to that, to evaluate that, we realized that 60% of our patients is from Istanbul, the biggest city of Turkey. And we recorded, they found that Istanbul recorded 2,100 more deaths over recent days between March and April, according to the previous 4 years. So you see the number of deaths. But it's not matching with the number of deaths due to COVID-19. So this showed us something. We are missing, we have missing numbers of COVID cases and deaths as they have negative PCR testing, and also patients with serious health problem may avoid seeking medical care during outbreak, and they die at home due to collateral complications. And as a summary, I can say that for my country, we are good at patient care and treatment, but we need to improve our testing in terms of quality and quantity. And it would be informative to take into consideration all patients with diagnosis of possible COVID-19 and recalculate and analyze the patient data, including cases and deaths, would be very helpful. I would like to thank you again for your invitation. And our chair has a question to me. When do you think travel and gathering restrictions should end? I would say we should implement we should measure the implementations, and we should keep on this quarantine curfews, and we should be very careful about continue the isolation. And I would say by the end of June, maybe we will take a breath and say we can travel and gather together, but everything should be step by step. We all have to loosen up the rules very, very slowly, I would say. And the other question was, when can I expect COVID-19 vaccine? There are, as you all know, ongoing 140 studies, and I would say it wouldn't be earlier than a year. Thank you very much for the invitation again. Thanks.